I think you just gotta click on the spot where you want. Yeah.
It is better.
That's pretty decent.
Okay.
Yes, sir.
Hello, good afternoon.
Good afternoon.
My name is Essenesis, and I'll be a physiotherapist today. Can I have your name, age, and where you're from?
My name is Joshua. I am 22 years old and I'm from St. Martin.
Joshua, 22 years old from St. Martin. How long you've lived in St. Martin?
For 22 years old.
22 years old.
22. I meant to say
22
for
years.
22 years, from that.
Okay, 22 years. Okay, that's a pretty long time. And you're in the Netherlands. What brings you here?
Studies. I came here to, study.
Study. Okay. And so come here. Been living 22 years in St. Martin. Came to the Netherlands to study. So what brings you in here today?
I've been having some issues like with my shoulder and stuff. Like, just wanted to get some advice and maybe just want to know why or how it's the way it is.
Okay, I understand. Okay, so I have some problem with your shoulder. Okay, that's good. Okay, so you came in here to assess how you have some issues with your shoulder and you like to have more deeper insight about it. Okay, so before I would like to delve deep into it, I would just like to ask you a couple of questions, yes or no questions, to see if you're in the right place and if I can offer you the right expertise. Is that okay?
Yes.
Okay. So I have the questions on my computer. Is it okay that I read it to you?
Yeah, sure. Go ahead.
Oh, great. So I just want to ask you yes or no questions, and if I have any questions I would like to have my answer or more elaboration upon it, I'm just going to ask you to elaborate upon it. So, do you feel sick, lifeless, or exhausted?
A little bit exhausted.
A little bit exhausted. And can you offer me some more information upon that?
Yeah, with school and deadlines and trying to meet them and, staying up late and high loads of caffeine intake, that eventually leads to exhaustion.
So, school, life, some stresses, and then a lot of caffeine intake, that leads to you leading to exhaustion. Okay.
Correct.
And what would you say exactly leads to exhaustion? Is it what would you say leads to exhaustion?
I would say just having the engine going without ever giving it time to cool off. I think that's like one of the biggest things.
Okay, so like you say, cooling off the engine without giving time to cool off. Can you be more specific?
Like, for example, if I keep on going and let's say I finish school and I go to work and then I stay up till like 2 trying to do some more work and just keep working and not enough time to sleep or rest. So
not enough time to sleep or rest, and then
when you're trying to take caffeine like as a way to to keep going, but then eventually you crash.
Yeah. So you life and school and work, and at 2 a.m. If I get it correctly, you said 2, but is it 2 a.m. or is it 2 p.m.? Like 2 a.m. in the morning or
2 a.m.
in the morning, and then you would take caffeine on top of that. To try to. Why would you take caffeine? Why?
I guess caffeine prevents you from sleeping.
Yeah. Okay, so caffeine prevents you from sleeping, and then you would stay up. Okay. All right. Okay, we got some proper understanding about that. Do you have trouble concentrating?
Ooh. Yes, because of the exhaustion, but when I'm not exhausted, no.
Just because of the exhaustion. So in this case, because you up at work at 2 a.m.
Yeah.
It's like lack of how many hours do you sleep?
Don't have a very strict sleeping schedule, but if I have to say on average, let's say 5 hours or less.
5 hours or less. Okay. All right.
Or maybe 5.5, but let's say 5.
Wait, why is that the case?
When you sleep bad once or 3 times, you tend to do it more and more. And this bad sleeping came from school, so not school per se, but me, not managing my time right and having to fight really hard or desperately in the end.
Okay. So school and time management.
Yeah.
Okay. Have you had a fall or accident recently?
No.
Do you have a fever?
No.
Are you taking any medications?
Negative.
No, only yes or no?
Oh, no.
How is your appetite?
appetite.
Yeah.
Mm, what do you mean, like, how's my appetite? I don't get the question.
Like, do you feel
Hungry often or like?
hungry like throughout the day, and how often do you feel hungry?
I would say normal. Like,
Normal.
I don't really know how to put it, but
How
yeah,
many?
I think I eat about 2 or 3 times a day.
2 or 3 times a day. Okay.
Yeah.
Okay. So 2 or 3 times a day you eat. All right. Have you lost a lot of weight recently? More than 5 kilograms within a month?
No.
No. Do you have any pain? If you have pain, say yes. If you don't have pain, you can say no. Can you do you have pain?
A little bit, but it's nothing to worry about.
A little bit of pain. Where do you have to feel the pain?
Like in my right shoulder.
In your right shoulder. Okay. Can you describe the type of pain? Is it sharp, like a stabbing, sharp pain? Is it a constant pain? Is it like electric pain that goes through your shoulder? Like, would you be able to describe it in a way to visualize it?
It's more like it's not constant, but it's less like a stab. You could think of it like a stab, but it's like a lot less.
So it's like a stab, and if you were to rate it on a scale of 1 to 10, where 1 is like the least amount of pain and 10 is the greatest amount of pain you would feel, where would it fall on the scale?
I would say like a 3.5, maybe 4.
3.5, maybe 4, and okay, 3.5, maybe 4. And in what situations does that occur?
I guess like if I maybe after exercise or like if I'm lifting up something heavy, or like if I do a certain motion.
Do a certain motion, lifting something heavy. Okay, all right. Can you influence the pain through exercise?
I believe so, yeah.
Yeah. And is the pain increasing through exercise or?
I don't think so, no.
No. But you said the pain is influenced through exercise. What do you mean by that?
I think it's like a motion thing. If I move a certain way, then I feel it. But if I don't move it in a certain way, then I don't feel it.
So if you move in a certain way while you're doing exercise, specific exercises,
Yeah.
you feel it. And when you don't feel it.
Yeah.
Okay, so it's situational.
Yeah.
Okay. Okay. Do you have any radiating symptoms, tingling feelings in your arms or legs?
No.
No. Do you have loss of strength or in your arms or legs?
No.
Do you have or ever had cancer?
No.
No. Are you confused or sometimes less conscious?
No.
No. Do you sleep well?
No.
Do you have pain at night?
No.
Do you experience night sweats or chills?
No.
Are you following any treatment from a specialist doctor?
No.
No. Okay. I'm just gonna ask you some more questions regarding like different regions in your body, just so you can be aware of the questions ahead. Okay.
Yeah.
So I'm gonna be asking questions about your head. Okay. So is this the first time you have a headache? Have you ever had a headache?
Yeah, but I can't remember the last time I did.
Yeah, you can't remember. Okay, so would you say that? What would you say?
Like,
Recent or like?
okay, actually, no, now that I think better, I got a headache, but it was due to like me having a fever.
Ah, you had a fever. Okay.
And then I got a headache, but that was a couple months back.
Couple months back. Okay.
Yeah.
Okay. So you had a fever. Okay, that was a couple months back ago. And then, how about now? How is the situation now?
Everything is fine now.
Everything is fine now.
Yeah.
Okay. You said you had a headache. Has the headache started suddenly?
My headache started to what?
You said that you had a headache a while back, and you said that it was due to a fever.
Mm-hmm.
Okay. Have you? So where did you feel the headache then, if you can remember?
It was mainly to like the side of my head. I think maybe on the front and also a little bit on the top of my head.
Okay.
Like there was the most of the sensation.
And why do you think that was the case?
I have no idea.
No idea. Okay. All right. Have you experienced nausea or vomiting lately?
No.
No. Do you experience blurred vision, spitting, or double vision?
No.
No. Okay, now I'm gonna ask you more questions regarding your back. Your back. Is it the first time you've had? Have you ever had back pain?
I don't know if you should call it back pain, but yeah, maybe a little bit lower
A
back.
little bit. Okay, lower back. Okay.
Yeah.
And you said you've had back pain. Does your back feel extra stiff?
No, not stiff.
Not stiff. Okay. Have you recently lost feeling in the area on the inside of your thighs?
No.
No. Can you hold your pee and poop well?
Yes.
Does it sometimes contain blood?
No.
No. Okay, we're gonna move on. Muscles and bones. Okay. Does your joints hurt? Your joints.
No.
Okay. Are your joints swollen?
I don't think so, no.
Okay. So if I could just give you a proper visualization of what I'm referring to, because I remember you mentioned your shoulders.
Yeah.
Can you show me exactly where, you said on your right shoulder, can you show me exactly where do you feel yeah.
Okay, it's less of the shoulder, but I think it's more like in the...
Behind on the back.
Yeah, like
Okay,
around...
on top there. Okay, all right. Okay, I have a proper visualization now. Okay, all right. So, okay, so your joints, do your joints hurt?
No.
And are your joints swollen?
I don't know, but if this is considered a joint, then I would say yes, just rest a bit. But yeah, like, I don't know, I think so.
Okay, I think so. Okay, all right. We're gonna elaborate more upon that. Now we're gonna be talking about some specific stuff inside your body. Are you familiar with diabetes mellitus
No.
or diabetes in general?
As in, like, knowing what it is, or
Yeah. Are you familiar with diabetes?
a little bit, because
A little bit.
yeah, it runs in the family.
Oh, it runs in the family. Okay. And okay. So, do you experience a lot of thirst that makes you drink more and urinate more often?
No.
No. Are you known to have thyroid dysfunction?
No.
Okay. Do you experience restlessness or agitation, or are you more sluggish?
Ooh.
I see you're thinking about that one.
Yeah, because I remember how I mentioned the exhaustion. I think it's a mixture of both, but I don't think it's from diabetes. It's more like, okay, I'm restless because I'm trying to get something done, and then by staying like so long on that one thing, I end up being more sluggish throughout the day.
Okay, so it's not related to diabetes.
No.
But it's related to your schedule or
Yeah,
sleeping?
personal routines.
It's just personal routines. Okay. Do you feel very hot or very cold?
No, neither.
Do you sometimes find yourself shaking without being able to control it?
No.
Does your throat bother you?
No.
Central. We will be talking about more regarding like stuffing that happens in your brain. Okay, just stuff that happens in your brain. And of course, if I mention any question that you don't particularly understand, you can always ask for me to elaborate and make it more explainable or understandable for you. Okay. So, do you have a headache?
No.
Are you dizzy?
No.
No. Do you have trouble seeing?
No.
How is your hearing?
It's good.
It's good?
Yeah.
Do you ever experience short absences?
Short absences, as in like spacing out?
Yeah.
Yeah, time to time.
Time to time. Yeah. Can you elaborate more upon that? Like in what specific situations and where does it happen?
It could be anything. Like I could be sitting down, just staring off into space.
Oh, you mean like zoning off?
Yeah, just daydreaming.
Daydreaming. Okay.
But
And
not per se like I was watching a video and then I lost focus. Not like that.
Consciousness.
Not like that, but like just daydreaming from time to time.
Daydreaming. And how often does it occur?
I would say, let's see, a 1 out of 4,
1 out of 4 times.
or maybe 1 out of 5. Let's say 10% of the times.
10%.
Yeah.
And how would you describe that
1
in
out of
your
10.
daily? 1 out of 10.
Yeah.
How would you describe that in your daily life? How often do you think like you would have short absences, like short moments where you said daydreaming, but in short absences I'm referring to spacing out completely and being unaware of what's taking place.
Oh, okay, no, never. That never happened.
Oh, never happened. Okay, all right. So that's just more
Sorry,
clarification. That's fine. It's fine. Do you ever notice loss of strength in your body?
No.
Do you ever experience sensory, sort of like losing sensitivity, like to certain things, like sometimes you feel numbness, or no? Sometimes you can't feel the table when you pass. No, okay. Or do you feel hypersensitivity, where sometimes you feel like more than you're supposed to from situations, like
No.
Okay. Do you ever struggle to control movements?
No.
Do you ever have balance problems?
Balance problems? No.
No. Okay. Have you had any recent trauma?
Recent trauma? No.
No. Have you had any long-standing unexplained fever?
No.
No. Have you had any weight loss? Just to make sure. No.
No.
No. Have you had any long-term use of medication or corticosteroids?
No.
No. Have you had any constant pain that does not diminish at rest or with change of position?
Constant pain, as in like always feeling the pain, or?
Yes.
No.
No. Okay. Why did you? Oh, like you said, constant pain.
Yeah, I just wanted to make it clear. Just wanted to be clear, because if it was constant pain or pain that comes and goes, just want to see if there was like a.
Well, it can be pain also that, like, let's say for example you feel it like 3 days and then 2 days it doesn't come, and then 3 days it comes back again. Like it can also be periodical pain.
Okay, then no, it's not like that. It's more like a conditional kind of thing.
Conditional. Can you offer some more explanation upon that topic?
Yeah, it's basically the same thing with
the back. Okay. And how often would you say that pain occurs to you?
Only when I do certain movements.
Only
so if I don't move that in a certain way, then I will never feel it.
So only if you do certain movements, then you will never feel it.
Yeah.
Okay. What movements would you say offers you, or like is it painful? What movements?
Like just doing, like, if I raise up like this and then I bring it back down like this, there's like a little bit of a pop. I would say it hurts less than cracking it. It hurts a bit more than cracking your knuckles.
Yeah.
But it doesn't hurt to an extent that needs a lot of attention.
Okay. All right. Do you have a general feeling of unwell-being?
No.
No. Do you experience night pain that persists for a long time?
No.
Do you experience numbness or neurological symptoms? Okay.
No.
Okay, I'd like to ask you some questions where you can just say okay or not okay.
Okay.
Have you ever had neurological emergencies?
Neurological emergencies? Not okay.
Do you understand what I mean with neurological emergencies?
Like something to do with your neurological system?
Yeah, like blacking out or being unaware of what's taking place, or...
No, and by saying okay, am I saying yes that I experienced that, or...
Yeah.
Okay, then not okay.
Not okay. Okay, have you had any damage or fracture occur to you in the past week or month?
Not okay.
No. Have you had any infection?
Infection, not okay.
No. Have you had any tumors?
Not okay.
No. Have you had any inflammatory disease?
Not okay.
No. Okay. All right. So these are the ending of our questions, and it just offered you. It just was to make sure if you was in the right place, if we can offer you some more the right expertise for your situation. And you're in the green. It seems that we have.
Let's go.
Okay, so, and this year.